Hey, I'm Dr. Bob Payne, a veterinarian at southkendall.com. Let's talk about how to raise low platelet counts in dogs. For one thing, we need to find out how low it is. If it's really, really low, you need to find out why it's low. Is it autoimmune problems, or is it from a tick-borne disease, or is it from cancer? And all those three things are the main things I see in my practice that can cause it. Cancer can cause a foreignness to the platelets because they go through the cancer cells and the platelets become, let's say, changed in morphology or characteristics, and the body thinks they're foreign. And so if there's a cancer, you have to remove the cancer. And the most common cancer we see with low platelets or thrombocytopenia is splenic cancer. And if it's a big dog, have your veterinarian check it out, because if it's low platelets from that, you need to get rid of that spleen. But you also need to get that platelet count up as well, and so you might need to transfuse the dog. We use steroids for low platelet counts if it's autoimmune, but again, autoimmune could be secondary to cancer. It could be secondary to a parasite called Ehrlichia that we see a lot in Miami that can taint the outside of the platelet and cause the body to think it's foreign, and they get low platelets. If it's autoimmune by itself, which is often the problem, we use steroids as well, but you got to be really careful because steroids can cause ulceration and bleeding of the GI tract, and that can cause you to have more problems than the low platelets. With low platelets, if it gets really low, it can cause serious and fatal problems. They can bleed completely out. So you need to keep your dog very still and very, untraumatized. They can't be playing with other dogs. They can't be running around, because if they get hit, they could bleed out. But normally you have to watch. There's multiple etiologies for the low platelet counts, so you need to know those.